Hey guys, welcome to this screencast for Epic Instructions on improving the use of the AVS at discharge. The purpose of this screencast is to walk you through the steps necessary to ensure that all AVSs are accurate, complete, and meeting best practice standards. But before we begin, let's briefly talk about why. Why do we need to improve or even in some cases change the way that we use the AVS? Well, the answer is the same as the rationale behind most changes these days, of course, which is to improve the safety and quality of the care we give our patients. No, our unit does not have problems with unnecessary readmissions, but decreasing readmissions is a focus of the HTTP project that we have been discussing, and Meridian Park as a whole has some room for improvement. So as a result, Meridian Park is the second legacy hospital to roll out the standardization of the use of the AVS to ensure that all patients, regardless of their reason for admission, whether it's med-surg or family birth, have the most accurate information for discharge, thereby preventing readmissions. But lastly, let's face it, not all our providers do the best job filling out the AVSs. For instance, the OBs tend to do a better job than the pediatricians. So as a unit, we have room for improvement ourselves. All right, let's begin. Here you see listed the 4 essential elements of the AVS that must be present for all patients, regardless of their reason for admission. First of all, the PCP must be populated and, of course, correct. Secondly, patient discharge instructions must be complete, which means that they include information for all patients, including the peds, on diet, activity, and when to call the provider. Thirdly, follow-up appointments must be listed, including the name and address of the provider. And lastly, the medication list must be accurate with appropriate instructions and the time of the last med administration. All right, let's tackle the first element, updating the PCP. Adding or changing the PCP is a task that really should be occurring on admission, not discharge, and we'll talk more about that on the next video. But let's say when you sit down to preview the AVS, you notice that the PCP is not listed or is incorrect. No worries, updating it could not be any easier. You simply double-click on PCP at the top right of the banner bar, then search for the PCP name or clinic in the pop-up window and click Add. Easy peasy, right? All right, element number 1 is complete. Let's move on to patient discharge instructions. From here on out, all the essential elements of the AVS will be found from the Discharge Navigator. So if after previewing the AVS, you find that the discharge instructions do not include complete or accurate information on diet, activity, and or when to call the provider, you can add the missing information by going to the Discharge Navigator, clicking on Patient Discharge Instructions, select the DC-OB order set, then open order sets. When you open the DC-OB order set, you'll see that some items are pre-checked and appear with a hard stop. Well, these are things that should have been addressed by the provider in their discharge workflow and things we don't want to address ourselves. So the first thing we'll want to do is clear those by clicking on Clear All Orders in the upper right-hand corner. Now you will see all the orders have been cleared, and you can go ahead and select any missing discharge instructions on diet, activity, and or when to call. But if after going through the discharge instructions you realize that you do not need to add anything new after all, just scroll up to the order set search area and click Remove Open. Otherwise, what you're going to do is go ahead and sign the discharge instruction orders with a mode of LIP signature not required. All right, we have the first 2 elements updated and correct. Let's move on to follow-up appointments. Again, start in the Discharge Navigator. From there, you can add or update follow-up appointments by clicking on Follow-up. Then search for the provider or clinic and add all pertinent information. You should be able to find most to all of the providers that you would need in the search field, but if not, you're going to have to go ahead and add the contact information yourself. And again, remember to address the why and the reason for follow-up, and feel free to text any pertinent information like Dr. Kelly's office will call you for appointment in 3 weeks or something like that. All right, we're almost there. Lastly, we have to update medication list. To add medication details, go to the Discharge Navigator again, then select Add Med Details. To write additional instructions, you just click the Add button next to the medication. And to write the time of the next dose, click on the pencil icon in the time columns. This top box is how it looks when you enter it on the AVS, and the bottom box is how it will appear to the patient when you print it out. All right, woohoo, you did it. All essential elements are complete and accurate, so now it's time to print the AVS and review it with the patient. So go ahead and click out of this screencast and open the next link for the YouTube video that will show you how to put this all in action. Thanks a lot.